Would like to invite moderator Dr. Newton Lewis. Dr. Newton Lewis is an academic editor of AAHA textbook of Adolescent Medicine 2024. He has published many chapters and he has published a book of Malayalam and childcare in 2019. And he is a senior consultant at Danya Mission Hospital, Pota, Kerala. Welcome, sir. With that, I would like to invite our panelists for the same. The panelist I would like to invite Dr. Latika Bala. She is a senior consultant adolescent pediatrician at Sir Gangaram Hospital, New Delhi. Dr. Ajit Singh Chawla is a consultant in pediatrics and adolescent pediatrics at Chawla Hospital, Gurmar Mandi, Ludhiana. Please welcome, sir. He is a trainer of IIPA programs for Mission Uday, Mission Kishore Uday, parenting, emotional intelligence, etc. With that, I would like to invite Dr. Mohit Vora, sir. He is a pediatric gastroenterologist and hepatologist at Jaipur. He is secretary at Jaipur IP presently. Welcome, sir. And he has good number of publication at national and international labels. I would like to invite Dr. Jugesh Chatwal, ma'am. She is a professor of pediatrics at Greater Noida, Uttar Pradesh. And her areas of interest are adolescent, asthma and infectious diseases. Welcome, ma'am.
Hello. Good morning, everyone. It is very interesting topic and need of an hour to discuss SUDs in adolescents. For this talk, I would like to invite Dr. Newton Lewis, sir, to moderate the session.
Good morning, everyone. I'm very happy to be the moderator of this August panel, which contains very big speakers like Dr. Ajit. Yes. So I am the moderator, now Dr. Newton. And we are panelist, Dr. Ajit Chawla, as you know, former recent national chairperson of our conference, of our AHA. Dr. Jugesh Chatwal from Noida, and who has given presented papers at many international conferences. Dr. Mohit Vora, who is from Jaipur, IIP Jaipur secretary and a pediatric hepatologist. Dr. Latika Balla, adolescent pediatrician from Gangaram Hospital, Delhi for the last 20 years. So, Dr. Ajit Singh Chawla will introduce the topic. Sir, do you think that substance use is a big problem in our country for our adolescents?
We are opening basement, my dear friend. Okay. So, substance abuse is a great problem in India. Not only in India, in all over the world. The adolescent period is a critical period marked by a rapid physical, emotional, and sexual cognitive development. Teens are more susceptible to the risky behavior, including substance abuse, due to the combination of biological, psychological, and social factors. So, issue of substance abuse is emerging as a global public health problem in 21st century, affecting every country worldwide as a drug trafficking. So, my dear friends, United National Office of Drug and Crime has reported there is a 296 million of the persons who are consuming drugs. And it accounted about the 5.6% of the population. And the recent study in the 2023, there was a rise of 5% more. That is, total is a 314 million people who are suffering from disease. So there has been a concerning increase in the this substance abuse in India also. So the tobacco use is found in the 6th standard onwards. And you see, when the studies are conducted, as we used to say uh, about the depression and other, it starts in the 50% of the cases less than 14 years of age, whereas it is the 75% of the cases they start in the less than 24 years of age. In the same way, the substance abuse, it accounts about the 60% of the cases who started in the adolescent period. So, see, most of the common drugs which are taken, one is the alcohol, then is the bhang, then is the, you can say, opioid, hashish, and tobaccos. You see, the big countries in India, that is Mizoram and Meghalaya, they are topping the list. Their mortality is also increased. In last year, Punjab is leading in this. There were 144, and it is followed by the Rajasthan and other countries. So trafficking is a very common problem, and you see, it is in September itself, this month, Interpol detected the drugs of the about 6.5 billion all over in 18 countries. 6.5 billions amount, it is dollar, but not rupee. In the same way, in September itself and in June itself, there are a lot of catches are there from, you can say, Telangana, Punjab. There are a lot of this. So, as a part of zero tolerance, by and you see in the Kerala, it is mentioned in a Kerala drug crisis, but it is not so. This is a study in 2022 to 2024. After the strict government rules and the cooperation of the persons, and we are coming down. You see, this slide which I had already discussed you, this about this. Now it is under the leadership of the Prime Minister, Shri Narendra Modi, more than 25 crores worth of the drugs was seized in 2024. And Delhi भी पीछे नहीं रही, वो भी पंजाब के साथ ही चल रही है आगे आगे. Next please. Next please. Next please. Next. So these are the drugs which are not, these are the few countries who are not consume the drugs. वो उसमें आगे एक Cyprus आ गई, and there are 3-4 in New Zealand and Norway also. These are the countries. Next, please. Over.
Yes.
Okay.
List.
So this is one more important slide my friend has shown. WHO defines the substance abuse as a harmful or hazardous use of the psychoactive substances. And there are two types, licit type or illicit type. Alcohol, caffeine and nicotine, it comes in the licit type. It is taken not in the higher amount. Then it is illicit drugs, they are the cocaine and the cannabis and other things, opiate, it is counted in that. And not only this, amphetamine and its allied products. So as a substance abuse is a substance dependent and it is replaced by the substance use disorder. So substance use disorder is a pattern of substances use leading to clinically significant impairment or distress characterized by impaired control, social impairment, risky use, pharmaceutical criteria, and substance misuse is the use of the drugs for the medical unacceptable manner. So there are not only this person is taking this, and there are other things also. There are consequences, bad consequences of this. Next slide, please. These are the consequences. Their effect on the social cost, domestic violence is there, child abuse is there, neglect is there, then sexual proximity. Even the cases of date rape is also reported. Increased criminality, crime rate is increased. Economics, it affect on the this status also. Health cost, mortality is about 5%, whereas disability person, it is also high. So other whether it is associated or not associated with this, or it is comorbidity, depression, anxiety, others also, RTA common. And there are, if the injectable drugs they are taking, they will be having the blood-borne diseases. Thank you.
Thank you, sir. Very, very detailed introduction to the subject of substance use. So, I'll take over at this point. The theme of this workshop is the vicious cycle of addiction. What is the neurobiology of addiction? Why do persons get addicted? Put it very simply, we have the limbic system. The limbic system is that blue area that we see, the inside of the brain, which controls our emotions, whereas intelligence originates from the cerebral cortex. Now, the limbic system is very well developed in all mammals. Whereas the cerebral cortex, it is very minute, it is only the size of the limbic system in a rat. Whereas in the human beings, it is massive in size. What this means is that the rat has no cerebral cortex worth talking about. It responds emotionally to every stimulus. Whereas human beings, we have the capacity to use our intelligence to to manage our emotions. This presumes that the cerebral cortex is fully mature. Now, the prefrontal cortex, the white box you see on top, the prefrontal cortex is the source of your intelligence, decision making part, the planning part, what we consider as intelligence. That unfortunately becomes mature only by 25 years of age, whereas the limbic system is already mature by 16 years of age, which means that the adolescent is fully very, very emotional, but has very limited ability to control the emotions. Give a peg of alcohol to a 16-year-old, he gets excited about it. He takes a second peg, he gets more excited. He takes a third peg, he's intoxicated. Now, if we give a peg to a 25-year-old, he likes it. Give him a second peg, he again likes it. Give him a third peg, and he says, no, I like it, I want it, but I'm feeling a little confused. I'm talking too much. I'm talking too loud. Maybe not now. I want it this Saturday. So, that means that he is developing control. He can use his judgment with regard to drinking. So, what is the neurobiology of addiction? Basically, we have the reward system of the brain, that is the basal ganglia. Whenever we do something that is pleasant, eat food, have sex, we feel a little dopamine release. It makes us feel happy. We are rewarded for doing that. And so we want to do it again and again at regular intervals. And this is important for survival, both eating and sex. So that's a good mechanism. Unfortunately, all addictive substances act by hijacking the basal ganglia. They force the basal ganglia to give a shot of dopamine into the system, and the person feels very happy. So when he feels very happy, he's rewarded, he feels very happy, he wants to do it again and again and again. After some time, the dopamine levels come down. Once the dopamine levels come down, you have the amygdala, which releases the causes the opposing reaction. You get adrenaline secretion, that's anxiety, increased heart rate, increased respiration, increased blood pressure, anxiety, stress. So you don't feel too good about it. You've got psychologically, you are going under experiencing a withdrawal. You are feeling negative. On top of that, the drugs themselves will cause some negative effects on your body. So once the dopamine effect is gone, the positive effect is gone, you are going into a withdrawal. You are having negative symptoms. How to get rid of the negative symptoms? One, you can suffer for many hours. The other alternative is, if you immediately take one more peg of alcohol or whatever, the dopamine releases there and you feel relaxed. So there is a tendency when you have the withdrawal to go into the next phase. You want, you crave, you desire to take the same drug again. And you anticipate, if it is available, you will somehow manage to get hold of it, and again you get intoxicated, and that is the cycle. So, okay, this is how why we get addicted and why we have drug withdrawal. The body tries to protect us a little bit by a tolerance mechanism. It is there for many systems. When the basal ganglia are being overstimulated, repeatedly stimulated in good numbers again and again by a person who's taking the same substance again and again and again, what does it do? The basal ganglia, the receptors get desensitized, and the person behave when he gets 1 or 2 pegs of alcohol or one dose of some other substance, he responds, but the emotional, the excitement, the euphoria is less than expected. After some time, the 2 pegs, 1 or 2 pegs used to make him happy. Now it's not making him that happy. He has to take 3 or 4 pegs to get the same effect. So that is tolerance to the medicine, tolerance to the substance. Now the problem with tolerance to the substance is, now he's taking 3 or 4 pegs. He's taking a larger quantity. The benefit is the same, the positives. The negatives will be a much more severe withdrawal and much more physical damage happening to his body. And finally, we have to remember the concept of relapse. Look at that, amygdala, basal ganglia are all strongly connected to the hippocampus, which is also the seat of memory. Whenever a pleasant situation happens to us, the basal ganglia releases dopamine, and there's a neuronal connection directly to the hippocampus. And if this is happening very, very frequently, that neuronal connection becomes very strong. And you're not only remembering, okay, I have alcohol and I get thrilled. I have alcohol with these friends. I have alcohol usually at this table, in the house, in this table, with these friends. And you know, the paraphernalia of drinking is also part of the in a detailed memory that you have. So that's where relapse occurs. The person is an alcoholic. He decides on de-addiction, goes to the de-addiction center, comes back 6 months, 3 months back later, perfectly de-addicted, goes back into the same environment from which he developed addiction. He goes back at home, that table, he sees the table, oh, this is the place where I had the thrill, and his dopamine begins to rise up again. So he wants it more and more. This is the place where I always used to drink. He remembers. He sees his friends, he remembers again. He sees an advertisement, a bottle, he remembers. He sees somebody drinking on a movie, he remembers. Everything is there in the world to remind him of alcohol, and more than 60% of substance use, those who have been treated for it, de-addicted, relapse within 1 year. Prevention is definitely better than cure. Thank you. We will now go on to the next speaker, Dr. Jugesh Chatwal. Madam, it all starts with taking the drug or taking the substance and getting addicted. Why do the adolescents try all this in the first place?
Thank you, Dr. Newton, for that question. So, why do adolescents go in for experimentation? That is the question. So, experimentation is like trying it out. And here, when we are talking of addiction, so it's not just trying it out. Can I just go back to the previous slide?
Sorry.
There is also progression and abuse. So what is it that moves from trying it out to getting to progression and abuse? And quite a bit of background Dr. Newton has already covered with the neurobiology that he has described. So this is an underlying neurobehavioral vulnerability in the adolescents that is there, and this predisposes to experimentation. They have an imbalance of the reward motivation system, which is the mesolimbic dopamine circuit, and the executive control system, which is the prefrontal and the parietal area. So the development of these occurs at a different pace, and because of that, they are at a high level of reward motivation earlier in their developmental phase. So that is the propensity for experimentation. And once the executive control does not develop at the same pace, the progression and the compulsive drug use goes on, which Dr. Newton has already explained in detail how it happens. So this delay in the maturation of the cognitive control leads to impulsivity. It also leads to acting without thinking. They do not know what they are doing. They just act without thinking. And very important, inability to delay gratification. We all know that when we are dealing with adolescents, that they have this feeling of instant gratification. So this imbalance is important to understand when we are dealing with them, that they have these issues and we need to deal with them when we are talking about the adolescent abuse. Yes.
So
Next slide.
could you discuss the risk factors, madam?
So the risk factors for substance use disorders in adolescents can be in the family or at the individual level or at the social level. I put the family first because the parental use is very important, because that's the first exposure many adolescents may have of smoking or alcohol use within the family, within the larger family or within the immediate family. Family conflicts, which predisposes to stress, and then further experimentation and use of these substances. Lack of parental supervision or lack of parental discipline. Family history is important. So if there is a family history of use, there is a higher probability that the adolescent will also go in for substance use disorder. So there is no definite genetic or inheritance pattern. A lot of studies have tried to find out if there is a definite pattern, but none has yet come up. But a positive family history is associated with 3 to 5 times more likely substance use or misuse or abuse problem in the adolescents. So it is a great big responsibility on the family and the parental role models on how they are shaping their children. At the individual levels, males are more predisposed to substance use disorder, and adverse childhood experiences, which would include the family conflicts and other exposures, also predisposes to substance use disorder. Prenatal exposures, coexisting psychopathology ranging from depression to ADHD, conduct disorders, or sleep problems, all of them can predispose an adolescent to this issue. Poor scholastic performance is another risk factor. Stress or boredom. Very often the adolescents are bored. They want to try something new. They want a kick. They want gratification. And that is what predisposes them to the first experimentation and then continued use. And they have the risk taking behavior. Within the social context, the peer pressure, romantic relationships may predispose them to them. Peer pressure is very important. Take the first one, take the second one. So the peer pressure is important. The social media does not help situation. There are plenty of ads which all of us have seen, which shows different things to the adolescents, shows role models like film stars and others who are drinking or having other substance abuse problems. Cultural norms. What are the cultural norms in the society? They also influence this, and the availability and affordability of these substances. That is also important.
Yes, madam. So, when should a parent suspect that my adolescent is using drugs?
So some of the red flags which the parents can look at and they can pick up if they are observant and they are spending time with their adolescents would be changes in their physical appearance. This is important because parents day to day are looking at their child. So bloodshot eyes or dilated pupils, if they can make out. Sudden weight loss or sudden weight gain, both can be there, and if that is happening, one needs to be on the alert why it is going on. Poor hygiene or neglected appearance. The adolescent is not bothered about how he is looking. Usually, the adolescents are very neat and they want to impress the peers or the opposite gender, so they would be usually neat, clean, and smartly dressed. But if they are maintaining a poor hygiene level or having a neglected appearance, and they are more concerned with getting their next fix rather than about their appearance. There may be certain unusual body odors with some of the substances which the parents can pick up because they are in close contact. Then behavioral changes. If there are drastic changes in the friends that they are maybe befriending odd people, older people. So if that is happening, different social groups they are joining, that may be an indication that there has been some change in their behavior and problems. A secretive behavior or lying, withdrawal from family activities, verbal or physical abuse of the family members, picking up fights for no reason, declining academic performance. All of these should raise suspicion in the parents this what is happening with their child. Sudden mood swings and irritability, tired, lethargic, depressed. And very important is if in the room of the adolescent, cigarette rolling papers are found, foil, syringes, or needles are found. These are direct evidence that there is a problem with this adolescent regarding to the use of substance. And he's always demanding money or is frequently losing money or other expensive items. So these would indicate that something is going on.
So, madam, should we pediatricians be screening adolescents routinely for substance use?
Yes, even last evening when we were talking about the NCD, we talked about screening for substance abuse. So screening is very important, and every adolescent must be screened. We are not saying only the ones who have red flags. Every adolescent must be screened. There are a number of screening tools available. One of the screening tools which is easy to use, there are many other also, is CRAFT, which has car, traveling in the car, of what kind of a car, relax with what kind of people, how they are relaxing, when they are alone, how they are spending time, friends and family, whether they are forgetful, and if they're getting into any trouble. I'm not going into the details of the questionnaire in the interest of time, but this is what the craft is, the CRAFFT, that is easy to administer in day-to-day practice, even in the OPD basis, and can be easily done.
Thank you, madam. And this craft is easily available online. So we'll go on to the next speaker, Dr. Mohit Vora. So we all know that it's very difficult to manage, and with a high relapse rate, prevention definitely is a better option. The first step in prevention is always educating, the first essential step, educating the adolescents. So what would you like to tell an adolescent in a class about smoking?
So good morning, one and all, and thank you, the organizers, for giving me this chance. As sir said, it's a very important question. We have been discussing for last 20 minutes is SUD, substance use disorder. Basically, what is the character of this film? Who are the heroines of this film? That is what I'm going to talk about. Most important, when I say smoking to the adolescents, it is not only the cigarette smoking, but the e-smoking, the vaping, and the hookahs which are being in the culture. And whenever you are addressing the adolescent, you have to address each one of them separately, because the reason they said that if you are saying the cigarette smoking is bad, they'll pick up the e-cigarette smoking, looking at the culture, what is going on. They'll start doing the vaping. So you have to tell them that all these ways lead to have some immediate effects, some long-term effects, and got a social effects. So what are the immediate effects if I'm talking about? Bad breath, staining your teeth, your lips getting blackened. So that is what you have to make them a little fearful that this is what is going to happen. And if you talk about the long-term effects, it is a high risk of heart attacks, strokes, cancer, chronic lung disease. Besides, there's a decrease in your the sexual potency and the sperm count. Social aspects also, that they are disapproved and neglected by most and majority of the community. Tell them that even your e-cigarette smoking, there's a cartridge being fitted and there's a chemical known as tetrahydrocannabinol which is being used. They have been turned into vapors. All this is going inside, may result into bronchitis, COPD, and later on lung cancers. So we have to put across their mind the short term, the long term effects, and that is the reason that these e-cigarettes and vaping has already been banned in India since 2019. Another culprit, if you go beyond smoking, is alcohol. Now that is again a very common indulgence that what we see in adolescents, and just put across them the amazing facts that 26% of the youth, they have their first drink of alcohol before the age of 13. Means almost out of 126 people before the age of 13 have tasted that what is the alcohol. And alcohol itself is the major factor. More than 50% of the motor vehicle accidents, homicides, suicides among youth, the majority, more than 50%, you have alcohol as the culprit. Tell them that if they have an indulgence in alcohol in less than 15 years of age, there's a high likelihood that 5 times they become alcoholics as an adult. And being alcoholic, again, lots of side effects, lots of personification needs to be done. They are not only the gateways to a habit forming drug, but also a gateways to a hardcore drugs which are highly potent and have a lots of withdrawal effects. So there are certain misconceptions about alcohol. People feel that beer is better than hard liquor. So it is not the fact. If you talk about 360 ml of beer and 45 ml of hard liquor, or your the hard drinks, are equivalent in intoxication by ethanol. So that is the toxic is the same. Just tell them it's not that beer is better than hard liquor. It is the amount which you take, it is the rate at which you take, which is more important, rather than thinking like this. Another concept is that alcohol drinkers are cool and non-drinkers are boring, isn't it? Many people think that, but that is more of a media portrayal. This is more of a social peer effect, peer pressure, which is resulting into it. Social lubricant theory. People say that you don't mingle socially well. That is a reason. So it is not the reason. What about bhang? Again, being, government outlets, you can see easily available on the streets, where the bhang you can get easily, the cannabis or the marijuana. So M for marijuana, M for motor skills, M for memory loss. The 3 M's you need to keep in mind and put across the adolescent group, that if you using this marijuana, your motor skills will be affected, your short memory is poor, so you can't study properly, you can't remember things properly, and that is the even the long term effects are bad. Then you go to the hardcore drugs. What are the hardcore drugs? You have LSD, you have MDMA, you have cocaine, you have heroin, and they are available in various forms. Why are they called hardcore? They're called hardcore because even a small quantity may cause intoxication. They're called hardcore because they're very potent. They're hardcore because they have lots of effects. They're hardcore because the withdrawal symptoms are pretty bad. So that's why they are called hardcore. And even a small amount of your LSD, whether you put a paper on your tongue, or you take a MDA, either MDMA in a powder form or an injectable form, whatever the form, it results into euphoria. It results into high energies. It results into increased power, but that is only momentary, fragmentary. That is, we should put across the mind of these people, and it has a long term effects. Even within hours you may get a withdrawal symptoms, you have severe fatigue, severe malaise, and the repeated use of the same day, as sir suggested, that your reward system which suffers, and occasionally it may lead to death. So this is what I believe, that we must tell adolescents in our meeting what are these drugs and how are they becoming addictive and causing harm to us. I think that's that, sir.
Thank you, sir. And finally, we come to Dr. Latika. Ma'am, we are all waiting to know from you about the treatment options.
Yeah, thank you very much, Dr. Newton, and congratulations to Gujarat AHA for such an elaborate and academic feast. So, the deliberation by Dr. Newton, how the neurobiology of the substance addiction works, as well as what ma'am, Dr. Jugesh, what she has told us about what are the how the system works at a mesolimbic level. So reward system is very, very important for the adolescent child. So how to reward them? That brain just works on the reward. So that is how we have to make them aware as well as make them feel that they can leave it. So almost 70% of smokers feel they desire to quit, but fewer than 10% they succeed without support. So nicotine, we all know, rather all these things, they strongly affect the brain's reward pathways, and which explains why there are relapses. So for the nicotine, we have a nicotine patch which can be applied for the 24 hours, may have to be used for 2 to 3 months. Another slide, sir. We have a nicotine inhaler, nicotine lozenges, nicotine chewing gum. So all these help the child once they are trying to be on the track. So that is what is important. Next slide. Uh, there are a lot of advances in the treatment for the nicotine therapy. This nicotine replacement therapy, which we've been talking about, what was the patches, gums, lozenges. So these are to manage the withdrawal. And then the prescription medications such as bupropion and varenicline, they are to reduce the cravings. And then, of course, the behavior modification or behavior intervention is very important. Till the time we don't have the behavior change, then of course the things will not be on the right kind of a track. So cognitive behavior therapy, motivation, interview, there, and a group support. The support to an adolescent child, that is what is the most important thing. And there are a lot of digital tools there for the NCD, also for the substance abuse, which are available, helpline and online cessation communities, which definitely can help. So we need an integrated approach where the medication, the therapy, support system, it shows the highest success rate. Next slide, sir. So we have to have multiple interventions. It could be early identification through the school-based screening, family-centered interventions, counseling with the parents and the caregivers, psychological therapy that we have been talking about, the CBT and groups discussions, and the medical management in form of a supervised detoxification, use of bupropion or naltrexone when required, and rehabilitation, vocational training, and the structured peer support programs, which is the most important thing. So once we come to the motivation interview, so the spirit of MI is there should be collaboration than the confrontation, evocation rather than the education, and then autonomy over authority. And that is what is important. So 5 general principles are express empathy, through reflective listening, develop discrepancy between their goals, value, and their current behavior, avoid arguments and direct confrontations, adjust to resistance rather than opposing it directly, and support self efficacy and optimism. So there are a lot of government initiatives for the political laws, then national narcotic drug and psychotropic substance NDPS Act is also available, awareness, Nasha Mukt Bharat, and the treatment and restructure network of the de-addiction center and rehabilitation centers are also there. And there are government partnership with NGOs, community organization, and international bodies. Next slide, sir. So final word is education and awareness at an early stage is very, very important. Very important to build resilience through the coping schools, which can be started as early as in schools. Strong family and community support system have to be placed in. Providing healthy alternatives such as sports, arts, and vocational activity so that you can make the child busy in that. Early interventions for individuals showing signs of high risk, and that is all about it. Thank you so much, sir.
So thank you very much. We have managed to keep to the time limit, and we've tried to give as comprehensive a viewpoint as possible within the limited time. I hand over to the chair.
I thank from bottom of my heart to our moderator and our learned panelist for taking care of time as well as educating us nicely. I very much like the new term you coined for substance abuse, that is substance use disorder, that itself addresses adolescent in a positive way. And of course, we really we are thankful for government for enforcing such laws strictly, and we need a comprehensive approach, family care, social care, as well as in school also, making some strict rules and educating school teachers as well as students regarding this substance use disorder. Thank you very much.
So the questions. I think there is time for questions.
Yeah. Thank you so much. Thank you so much for such an enlightening session. And for this, I would like to invite chairpersons, moderator, and panelists for the memento at the back. Thank you.